Let's bring in now MS Now reporter Alex Tabbitt and pulmonologist and MS Now medical contributor Dr. Vin Gupta. Alex, what more is HHS saying about this funding freeze?
Well, Ariel, this is a dramatic escalation from the Trump administration. In a video statement overnight, Deputy Health Secretary Jim O'Neill and Assistant Health Secretary Alex Adams posted a pre-recorded video with some major announcements. First, that HHS will be freezing all child care funding to the state of Minnesota. But it's more than that, Ariel. They also announced that all future payments from the Administration for Children and Families, also known as ACF, will now require justification and a receipt or photo evidence for payments or for future payments. They also called for an audit of Minnesota daycare facilities. And finally, Ariel, they announced that the department will be launching a dedicated fraud reporting hotline and email address. And I want you to hear just a snippet from that bombshell announcement.
We believe the state of Minnesota has allowed scammers and fake daycares to siphon millions of taxpayer dollars over the past decade.
My office, ACF, provides Minnesota $185 million in child care funds each year. That money should be helping 19,000 American children, including toddlers and infants. Any dollar stolen by fraudsters is stolen from those children.
Now, Ariel, this all comes in response to a viral video from a right-wing YouTuber, which claims to have discovered rampant fraud at daycares run by members of the Somali diaspora in Minnesota. But it's important to note, Ariel, that we don't actually know the veracity of those claims. And Tiki Brown, the commissioner of Minnesota's Department of Children, Youth, and Families, said earlier this week that her department has been checking in on those daycares highlighted in the video in the past few months. So far, she says that they've found no uncoverings of fraud, but she did say that there will be more check-ins on those daycare centers this week. And Ariel, this is all resulting in a war of words between Minnesota Governor Tim Walz and President Trump. Governor Walz posting on X overnight that President Trump is, quote, politicizing the issue to defund programs that help Minnesotans by freezing these HHS payments. And meanwhile, President Trump took to his social media platform, Truth Social, within just the last hour to call Governor Walz a, quote, crooked governor. Ariel?
Alex Tabbitt, thank you so much for those updates. I know we'll continue to monitor the investigation as it unfolds. But Dr. Gupta, this isn't the first time we've seen HHS make a move viewed as politically motivated. Earlier this month, the agency cut nearly $12 million in grants to the American Academy of Pediatrics after it said that essentially it and several other organizations no longer align with the department's mission or priorities. That was seen as a swipe against HHS Secretary RFK Jr.'s agenda. So talk to me as a physician about the trickle-down impact that these moves have on patient care, setting the politics of all of this aside, which has been the focus of all of this, and the massive fraud investigation that we're watching. How does this impact children in Minnesota?
Well, Ariel, we're seeing across the country, not just in Minnesota, but across the country with measles. And the tee-up you brought up, measles, we're going to lose our elimination status of the country for an infectious disease that impacts children predominantly. And take flu. We're now in the midst of one of the worst flu seasons we've seen, an early flu season. This is compounding, especially when we have the American Academy of Pediatrics being under-resourced, defunded. They are an advocate for everything that protects children. And we're having these compounding risk factors just as pediatric beds are becoming less and less. It's a convergence of factors here that should worry us all, especially those of us that are actually caring for patients.
So speaking of the flu, we're tracking that fast spreading strain that's hitting the country, families so hard. The CDC is now reporting the so-called super flu H3N2 variant has caused hospitalizations to nearly double in the last week. That's pretty staggering. What makes this variant different from others that we've encountered, and why is it so rampant?
Well, something that gets lost sometimes when we speak about the flu to the general public is that this is one of those viruses that finds a way to change and adapt and mutate. That's what's happened. Over the course of just the last 6 months, this new virus variant is more contagious. And we're finding that while the vaccine is effective, every single flu vaccine in any given year has imperfections. This one is still robustly protective against ending up in the hospital, but vaccine rates are low. And you did an incredible work reporting about measles in South Carolina. I was watching it. We saw measles vaccine uptake rates lower there. We're seeing flu vaccine uptake rates across all zip codes lower than they should be, even pre-pandemic. And that's creating vulnerability across society. And that's really what's driving a lot of hospitalizations. We're seeing peak hospitalizations very early in the flu season. We're still early. And that's the concern, is that this is still early.
Yeah, Dr. Gupta, thank you so much for the kind words. It was good to get there and get to speak to people on the ground, including physicians, families, administrators of the districts that are being hit hard by this. We also are seeing, of course, that spike, as you mentioned, in South Carolina. 20 new cases were reported since last Friday. That brings the total there to 179. And I should say, nationwide, we've surpassed 2,000 cases, and that's the highest in 30 years. As you mentioned at the top there, we're at the risk of losing our global eradicated status for measles here in the U.S. And I reported on the ground in South Carolina. Want to play a little bit of what a pediatrician told us there.
Yeah, we've had a few families that are totally against vaccinations, but again, once they see the real world implication of these diseases and what they can possibly do to people, again, they start thinking, I don't know, maybe we need to do this after all.
So clearly, you know, when this truly impacts your community, you start to maybe change your mind a bit. But there is still lingering vaccine hesitancy and refusal in a pocket of South Carolina. That's reflective of some other places in the country. Vast majority of cases are in kids who are unvaccinated, as you well know, or have an unknown vaccination status, doctor. So we've heard from experts, rely on your pediatrician for guidance. But as a physician, I'd love to know from you, when the onus is placed on a pediatrician or on a doctor to convince your patient to take a vaccine when you don't really have that support from the federal government, what is that like?
Well, there's only so much you can do in a 15-minute pediatrician visit. I know this well because both my mom and my wife are pediatricians. And so I'm close to the field. There's only so much you can do. That 15-minute visit is pressure packed. There's a lot to discuss. Let's just quickly emphasize a few points that I know pediatricians across the country want to make sure are emphasized. One, measles just doesn't make you sick once. Ariel, you saw this in South Carolina. There's something called immune amnesia. If you get impacted, especially if you're a child and you get infected with the measles, it can actually wipe out your immune system's memory against prior infections, prior vaccinations, making you more vulnerable for another different type of infection. It causes immune amnesia, and we don't talk enough about that. So that's number one. Parents out there need to be aware that this actually creates greater vulnerability for your child against all forms of infection. That's one. Two, it's contagious for up to 2 hours after somebody that's infected leaves a room. And three, the medically fragile and those under 12 months of age are especially at risk because they're not fully vaccinated.
Incredibly important points to elucidate for us. Thank you so much, Dr. Vin Gupta. Happy New Year to you, my friend. Appreciate it.